And action. Hey everyone, it's DrRic. Unnati had a question about food poisoning and what causes it, how to look for it, what to do to make it go away fast, and the treatment. So if this is the first time you're finding me though, don't forget to hit the subscribe button down below and the alert button to find out when I post new videos. That's not an alert button, that's supposed to be vomit, and that's supposed to be poop. Actually, that should be loose poop, not solid poop, because most of the time you have food poisoning and or gastroenteritis in the form of diarrhea, explosive diarrhea, bloody diarrhea. So let's talk about this thing. Food poisoning is just layman's term for gastroenteritis. Gastroenteritis is a nice way to technically or medically describe a problem with the stomach and a problem with the small intestine or colon. So let's talk about the mechanics of what happens. First of all, this model is the digestive system. It goes from the mouth, where you start to digest stuff with saliva and chewing and breaking apart. And then the stomach, where you secrete acid. The solid contents or liquid contents meet the acid. Acid turns it into liquid. That's your blender. And then when ready, the liquid settles down into the small intestine for absorption. And then it goes into the large intestine for further interactions with bacteria that are all friendly, your microbiota. So and then out the butt, or rectum and anus. That's the usual way it happens. And a food particle going from here to ending up in a toilet will probably take about a day. To some people faster, some people slower. But when you had food poisoning, and food poisoning is an infection most of the time. You can have it from caustic materials or chemicals, but for this purpose, we're going to talk about infection. Infection is caused by basically three things: virus, bacteria, or parasite. And there could be fungus, but we'll just stick with the three. Those are the most obvious things and the most plentiful things. Whatever the pathogen is, it goes in here through the mouth, the contact point, through food or kissing or beverage, ice cube, and it goes into the stomach and then starts its havoc, because this tube is supposed to digest food, hold food, absorb nutrient, and hold bacteria. It's supposed to do that. But and in the lining of this tube is supposed to let some stuff in, let some stuff out, move a little bit, so digest. So the concept of how this works is really fantastic, honestly, this whole system. And a lot of energy gets put into the system for it to work, extract energy from your food sources, your fuel, and then store it. So yes, it takes energy to digest energy and get more energy, but the net gain is always going to be for the better. When you have a bacteria, virus, or parasite enter into the system, those things, especially if they say are bacterias are meant to multiply quickly when the environment is ripe. And the environment is ripe down here. Don't think that if you have digestive acid, you'll kill all the bacteria and parasites and viruses. It doesn't work like that. Most weak bacteria do get killed. But just think about hepatitis. I mean, you can get hepatitis from food. That's a virus. And it goes into your bloodstream, gets stuck in your liver, and then you have hepatitis. So HIV, same thing. I remember hearing a young person say that they could have oral sex and not worry about HIV from their male partner because the digestive enzymes will kill the HIV virus. And that obviously is wrong. So the fallacy is this acid, especially if you're using proton pump inhibitors or H2 blockers, Pepsid, Zantac, Tagamet, Prilosec, that all, for you guys who have reflux, will stop the acid and allow everything to go on through, and that's not necessarily good. It's not good for the microbiota, that colony of bacteria that are good for you, that help you, that make emotion and hormone and help digestion. It definitely is not good for keeping the bad guys out, because some of the bad guys will get killed. Other bad guys will go through. One of the nastiest bad guys you'll hear about is Salmonella or E. coli. Those two bacteria if they're the right subspecies, can really wreak havoc with the rest of the colon. So when a bad bacteria, especially something that has high virulence, that reproduces fast, causes damage, causes fluid buildup, it causes the chemicals in the gut system and immune system to react violently. Those are all the cascade of factors that happen when a virus wants to reproduce itself. When it wants to reproduce itself, and viruses and bacteria are smart. They want to reproduce themselves in the gut as much as possible, as fast as possible, so that they can take over the host. And they regenerate, leave through the butt, and they go infect another host. It's just a fantastic, that too is fantastic in a bad way. But when the stomach gets exposed to that, the stomach will try to do its job to fight. So if a virulent virus or bacteria gets exposed, the stomach will say, wait a minute, that's not food, that's a bacteria, it's reproducing, let's dump more acid so we can fry it. That's one attempt, but if there's not enough acid being produced, and there's still multiplications of this bacteria virus happening, then the stomach says, whoa, that's not good, let's get rid of this thing. So it either makes that content go up and you vomit, you become nauseated, you vomit all the bacteria out, or virus, maybe even parasite, or the stomach says, hot potato, I don't want it, send it on down. So it'll send the partially digested food, the bacteria, the virus, maybe a parasite too, down to the small intestine. So the stomach is saved. The problem is, small intestine doesn't want it either. So small intestine doesn't really make acid. Small intestine has a lot of white blood cells, so it will try to protect itself. So the small intestine is usually the size of a garden hose, like that small. What happens with the small intestine is that it's a muscle, circular and longitudinal, it has 2 different fibers in it. The longitudinal fibers in the small intestine help to push food through. And just like a snake, you squeeze that thing through until it gets to the next part of the tube. The other part is going like this. It helps to move right on through and sometimes help digestion, definitely help with absorption. But here's the thing. When you have a bacteria or virus or parasite and the small intestine doesn't like it, it's going to dilate. So it goes from garden hose to fire engine hose. And it does that to get away from the irritation. So if the irritation is like this, it expands. Now what does that do? It bloats you. A lot of people will say, I gained 5 pounds within 5 minutes. But it's not really that you gain weight, it's usually that your belly it goes to bloat. Because that's the only thing that the small intestine can do to fight. Small intestine can also send out white blood cells because they're lined with something called crypts of Lieberkühn. And that's just nests of white blood cells ready to intercept anything that gets through the digestive wall and isn't good for you. And that's why when you have bad food, leaky gut, the crypts or those white blood cell nests will reproduce themselves fast to fight what you are eating, but inadvertently the white blood cells will also go through the bloodstream and fight you. So you'll end up with skin problems, joint problems, brain fog, autoimmune problems. And that's that leaky gut malabsorption issue, but that's for another time. I think I've done a video. I'll see if I can put it down below. And then what happens with the digestive system, or the small intestine, when it doesn't want something? It can't go backwards into the stomach because there's a pyloric sphincter that stops it. So it passes it to the large intestine. And that is where all the good bacteria hide. And when the good bacteria are hiding in the large intestine, and you give it those bacteria, those viruses, those parasites, large intestine does what it does best. It poops it out. And that's why you have explosive diarrhea. So the other problem, though, that happens is when food, along with that bacteria, parasite, or virus, comes through and gets past like a hot potato, undigested, then the food, if it gets to the large intestine, with all the bacteria, your probiotic microbiota, that's a colony of different good bacteria in you, when they have a taste of undigested food, They say, hey, thanks a lot, and they start to digest the food as their fuel source. And then when that happens, sometimes you'll have gas. So again, another reason for gas. The first reason for gas in the small intestine is bloat, expansion. Second reason for gas is when the microbiota are given to undigested fuel sources in food. So that's why it's really smelly. Undigested food can be digested by your bacteria. The rest of it goes right into the toilet. That's why you'll see partially digested food. You'll see a piece of corn or sometimes a vitamin that'll pass right through. That's because the transit time going from mouth to butt is sped up so quick. Usually capsules and medicines are made so that it'll follow the usual slow transit time. A couple hours of digestion in the stomach, a couple of hours of transition and travel through the small intestine, a day or two or whatever it is that you hold your poop for in the large intestine, and it's done. That's the way medicines and food gets absorbed. So that essentially is what happens when you have poison. And when you have the food poisoning, this gut is so bulletproof that usually a virus, we can deal with a virus by shooting it out fast or dumping acid. And usually most people get better fast. Rotavirus, norovirus that you'll see on the cruise ships. People will get sick, but they'll get better fast. Now bacteria live on a little longer, and they sometimes cause more damage. E. coli is one bacteria, and it is known, Campylobacter is another, Salmonella is another. The E. coli is known to cause cytotoxic effects. So that E. coli has cell walls, and it produces a chemical reaction because the bacteria itself is smart. It wants to invade the host. So it causes damage so that it can get into the bloodstream. Once it gets into the bloodstream, it has its food and it has the way to reproduce, perfect environment, and then it takes over. And then usually the immune system dies down, then the E. coli lives on, and the E. coli passes on through, and the E. coli goes and infects another person. And that's the way the species of E. coli go on to live. So the same thing with all the other bacteria, they work about the same way. These little organisms, whether the viruses or bacteria, they want to live. And they can live silently in food or in hosts that don't wash their hands, that don't necessarily touch their mouths. But when the perfect host comes up and the environment is right, conditions are right, then they massively reproduce and cause those big side effects. So how do we fix that? Well, we don't usually give antibiotics for viruses because viruses don't respond to antibiotics. Sometimes antivirals will be helpful, but that's a different story. Like influenza is usually an upper respiratory tract infection. When you have viral gastroenteritis, there isn't really a great antiviral to use. So we usually just ride the storm. Again, the gut can protect itself. It can do it so well that when you spew out the virus this way and the acid this way and the undigested food and the virus or bacteria this way, it'll continue doing that as a tube, a 27-foot tube, until all the viruses and bacteria are gone. The problem is, during all that time, you're also secreting a lot of fluid, and a lot of people get dehydrated. So if you've ever taken care of a little baby that has loose stool, you have to give them fluid. One of the side effects that causes death would be dehydration, especially a child. Electrolyte abnormalities occur when you're too dehydrated, and that's when the sodium and potassium is not enough. You can get seizures, you can get swelling of the brain, you can get heart arrhythmias that kill. So all that's dependent on sodium, potassium, magnesium. And when this gut is trying to protect itself, guess what? You lose all that stuff. That's how you make the fluids that douse the viruses and bacteria that carry things out of the butt or out of the stomach, mouth. So again, if we have somebody that's that bad, we try to control the vomit part, and we control the vomit part by giving Zofran. There are some herbals like ginger tea that do help minimally. There are some trigger points or acupressure points that do help to calm nausea. Acupressure also at the wrist calms nausea. Keeping on a brat diet. So you have to maintain fluids. If you're at home and you can't get an IV, you have to maintain fluids, and they usually have to be clear. Doing Coke and coffee, not good. Doing alcohol, wrong fluid, because those fluids cause irritation to the stomach. They also make you pee, so you defeat the purpose of keeping fluids in. Pedialyte is a common fluid you'll see in a lot of drugstores, just regular stores in particular. But if you've ever tasted Pedialyte, it's kind of nasty because it's mostly sodium. And I mean, the only company that I've found that makes a sodium that tastes pretty good is Coke. Why? Because you can't even tell in a can of Coke that it's mostly sodium. You can tell it's caramel and fizzy, but that is so high in sodium, and yet they've blended the sugar, fat, and salt so well you can't even taste it. And guess what? When you take that, because of the sodium, you get thirsty and you want to have another one. So ingenious. I don't like the Coke, but anyway. So sometimes club soda, Pellegrino, I like Pellegrino. Club soda is high in sodium, so sometimes club soda is not so good if you have high blood pressure, but it is good if you're trying to replete sodium. It also has that fizzy effect that I use it for. So the stomach, if it's calmed down, will take care of one reason for you to get dehydrated. The colon, if you're having hemorrhoids, if you're having bleeding, or if you have to go give a meeting or fly on a plane and you can't get to the bathroom every 5 minutes, we can paralyze this with a pill, Lomotil. Lomotil is essentially a narcotic and atropine put together, so it stops movement. The problem is, if you stop movement, and that's good for you because you can travel, remember the colon and small intestine and stomach are trying to protect themselves by pushing this bad crap out, really bad crap out with bacteria. But if you stop that for your convenience, you're actually keeping the bad crap in. So you can stop the loss of electrolytes and fluids, but you also get more exposure, longer exposure to the bacteria. So that might not be a good thing. If your immune system's fighting well and you're just trying to control the side effects of the bacteria that are essentially dead, okay, fine. I usually say if we're unsure whether there's a bacteria, virus, and or a parasite, it would be important to capture some stool. And so stool tests are important. They're kind of gross, but it's a way you can get the stool that you're spewing out fast and send it to the lab to look for C. diff, to look for bacteria, to look for parasites, also to look for that cyclospora. That was that one bacteria they found in McDonald's lettuce. Well, it was in more than McDonald's lettuce, and I still am having 1 or 2 patients show up with it, so it's not done. So again, it's important to identify. Once you identify that it's a bacteria, virus, or parasite, cool. Then you can take the proper action. So again, I mentioned to you, if you're listening, viruses don't usually have antivirals that work well. Bacteria, rarely do we give antibiotics because antibiotics can kill bacteria, but they also cause irritation. They cause more of the side effects. And in the long run, the gut is so good at protecting itself, we just wait. Now, if you're immunocompromised, you might need help. So that's a little different. Parasites anova, or parasites in particular, though, a little different. They kind of do the same thing. They're not as irritating to the gut. The parasites want to live in you. They don't want to be found. They don't want to kill the host. So a parasite usually makes its way through, buried in some kind of food or some kind of poorly cooked meat, some kind of poorly prepared meat where the person didn't wash their hands and they passed it on. And yes, they get from butt, don't wash their hands, put it in the food, and then you eat their food. That's how parasites passed. I had amoeba in the Philippines, and that was not fun. So, in fact, the symptoms I had from the amoebiasis and the dysentery, I would still think I'm going through that if I have any bit of flare-up of IBS. It'll remind me of the day that I almost passed out in the Philippines, straight to the beginning of the cramps. And that's a learned behavior, don't like it. But those of you who haven't had any problems with dysentery, parasites don't usually do that. Parasites like to be quiet. They spread their disease. They go to different organ systems, even the brain, and then they feed off of you, live. Sometimes even tapeworms would live without even knowing about it. So that is pretty much it. Now, as far as using fluids, if you can't get the Pedialyte, if you can't get club soda, if you can't get just fluids down, Then sometimes we have to give you IVs. Believe it or not, when you're dehydrated 3 to 5%, you'll feel really lousy. It magnifies all of your achiness, fevers, the bloating. So sometimes if you're getting to that point, if we just give you 1 bag of fluid, it puts you back into only 1% dehydration and you feel good to go. And then you can fight the infection faster, better, more attentive instead of taking time off of work. And sometimes it allows you to go ahead and start the sips without feeling too crappy, nauseated. Again, there's also nausea pills. There are pills that freeze the small intestine and colon. Then you have Tylenol. Usually we'll suggest a brat diet: bananas, rice, applesauce, and toast. Those are old-fashioned. It's a nice acronym for parents to learn when their kids have diarrhea. The brat diet is easy to use. It's not that great, but it gives you a little source of sustenance. And why do we teach it to parents? Because usually when kids are in daycare, especially now, it's starting. I had 2 patients already that work in daycares, and there's something already going around, and it's only the 2nd week of August. Imagine what life is going to be like when school is in full bloom and all these parents are dropping off their kids that are sick because they can't take the time off of work. And then all the workers at the daycares or the schools also are getting sick and spreading it to the entire class. Now that's never intentional, but you usually have the adults that are there, the daycare workers, the teachers. They know what to do. Wash hands, don't touch anything, but the kids don't know what to do. That's how you'll have rapid expression of multiple diseases and infections. Food poisoning is just one form of it, but there's also respiratory, sore throat, pharyngitis, strep throat, pink eye, bronchitis. All that gets spread too, but I'm just talking about the food poisoning or gastroenteritis. Finally, aside from knowing the side effects, and aside from trying to take care of the cramps, Tylenol, if I didn't mention it, would be helpful a little bit with the cramps, and then maintaining a little bit of fuel source and fluid. Sometimes there are herbs that can be helped or that can be used, and probiotic is a big one. When you're fighting a bunch of bacteria and your microbiota are overwhelmed, sometimes taking a probiotic would help fight. I always like doing herbs like astragalus, red reishi mushroom. If there happens to be a sore throat with this, I like spraying in reishi or shiitake, different mushroom sources to help calm down the pain and get you the exposure of the mushroom. Mushroom has this immuno-building effect, just like the red reishi mushroom I mentioned and the astragalus. They all are my usual go-tos when it comes to fighting or boosting up the immune system. Avoidance of toxins, like we talked about, is important, and usually protecting everybody else in the house. So whether it's an upper respiratory tract infection or it's a gastroenteritis, it will spread. So if you can stop the spread from that point on, take some time off from work, get some rest, you'll make it through fast. So Unnati, good question. Hopefully the rest of you are going to fare well this season. Watch it, allergy season's starting up already, and that usually means all the other infections are coming soon. So I appreciate you watching and subscribing. Stay tuned, and I'll see you in the clinic.